We're bringing you live coverage from Rising Sun Avenue in Northeast Philadelphia. I'm privileged to have two doctors. I'm a rich guy with two doctors. So I don't think anything is going to happen to me. I'm in the right place.
At the right time.
Yeah, at the right time. So I have Dr. Andrews and I have Dr. Hung Pham. Okay, Hung Pham with me.
Dr. Andrew Ankamah.
Yeah, he's Dr. Andrews is from Ghana and Hung is from
Einstein.
Yeah. Wonderful. I have two great men in my presence. So I want to have, I think Dr. Andrew was on earlier and he introduced himself. So I'm going to have Mr. Hung introduce yourself, who you are, a little bit.
Yeah, sure. So my name is Hung Pham. I graduated from Pecan Philadelphia College of Osteopathic Medicine. I went my training with PCOM 2 as well, and now I'm practicing at Einstein Medical Center, outpatient at Front and Olney.
Oh, okay.
I've been here for about 30, I would say about 30 years in the United States now. Been in Philadelphia in general about 20 years, and I'm very fluent in Vietnamese. I speak Vietnamese, and I also speak English too as well. And I think our practice is composed of like a lot of the very diverse group of number of ethnicities and nationalities too as well. Vietnamese, Latina, Spanish-speaking, Haitian Creole, Vietnamese, Cambodian, and also Laotian too as well.
Okay. Now you live in an area where it's very diverse. I know this area. And this hospital clinic is in an area that's very diverse. So I know the health issues in Philadelphia is a very big thing. Okay, so what's your take for the health fair? How did you get involved?
Well, one of my patients is one of the administrator here. She invited me, and I said I'd love to come, even though it was kind of late. I was so busy. I just had a baby, and
wow, you got a baby. Okay.
So it's just a lot of commitment. I think I have a lot on my take when I was. My ultimate goal in life is about giving back to communities. I grew up here. I like to give back to my communities.
Okay. Yeah. All right. And we have Dr. Andrew, who is a doctor in the fit and in the physical. Okay. Yeah. So Dr. Andrew. Okay. Now let's get into this. We found out that there are a lot of disease, a lot of things that are happening, and it's good for you to have you guys here. What is one thing that you want to talk to the audience about when it comes to in relationship with health?
Yeah. So I guess like the main thing is I think everybody talks about in the healthcare is the health disparity. So most particularly women's health. There's a lot of health screening that needs to be addressed. Mammogram, pap smears, and also for just in general for all people colonoscopy. They recently changed the colonoscopy from age 50 to now age 45. That's something that we need to address. Colon cancer is growing up so fast right now. The diagnosis of it, we need to address that soon. It's growing right now. It's at number 2 in the world, in the country right now. It's going to be number 1 soon.
Wow.
Yeah. So it's a thing that a lot of people need to talk about. I think a lot of people don't talk about.
Okay. And Dr.
Yeah, my specialty. First and foremost, I'll introduce myself. I'm a Temple University grad.
Okay.
And my specialty is sports and spine medicine.
Oh, wow.
Also physical medicine and rehabilitation.
Oh, wow.
Meaning all the orthopedic areas we cover. Our goal is to prevent an operation until as a last result. Okay. But to continue from what Dr. Pham just said, I think our culture, most African culture is we don't want to go to the doctor until it's very, very severe. Yeah. So I'm a very huge advocate of prevention. It's always better than cure. Make sure that you go for your yearly checkups, both the men and the women as well, if you want to live a happier and longer, healthy life.
Okay, now let me ask both of you. Do you guys have a problem with, do you face a lot of problem with language barrier?
Oh, yes. Yes. In my practice, I remember the number of languages we experience with. When the language barrier comes in, is the fact that they try and follow up with appointments, like colonoscopy. You tell them if you tell them to do a colonoscopy, of course they'll do it, but they have to call, make an appointment. That's the barrier. Yeah. Call the next step. It's just a follow up. That's the thing that's hard. What we're trying to do is trying to promote is in our practice in Einstein is that there's always a translator on the phone. Okay. Trying to translate them and try to schedule for them too as well. But it's hard, It's still primitive right now, but we're trying to grow more and more, and then get people screened early, and quick, in and out, and try and get everything done so that they can live, like Dr. Andrew said, live a happy, healthy life.
Yeah. And Doctor, the same thing with you, dealing with people from different countries, and having different. Some people don't speak English and all of that.
Yes.
What's the challenges and stuff like that?
It can create a barrier. We have Spanish population, but likely we have some staff who speak Spanish, and therefore are able to translate. But it's key. Any time you don't have the translator, it impedes, the healthcare that you are trying to deliver to them.
Okay. And I think it's important too as well, because we have health clinic everywhere. So the kids pass by of different nationality, come by and see it. Like someday I'll be a doctor and I can contribute to my own people.
Absolutely.
Like that's how I feel like when I grew up. When I didn't know what I want to do. I see health fair. Oh wow, maybe someday I can contribute to society. So it impact me. And hopefully someday the health fair and all this stuff we do is going to be exponential. It's going to contribute back to society. When kids grow up, they see it. They see what they see, and they grow up and make up. Maybe someday, this health fair, maybe the kids come by and see us, and maybe 3 or 4 of them become who are not speaking English right now, and then they're going to start speaking English. And they speak their own language, and they get back to the community, just like what we are doing right now.
Okay, so I'm not a health guy. Most of the time, I'll just go to
look good though.
Yeah, I go to the hospital, but when I go to the hospital, I'm scared that I always feel that something's going to happen. So what would be your advice to those that's watching? Most people feel that when they go to the hospital, the doctor usually just put something on them because they want the cash. People have the tendency of, so then you have good insurance, and you go to the hospital, something going to come, they're going to give you something, they're going to diagnose something for you. What would you say to that? Dr. Andrews?
I'll say that in this country, things are well regulated, and cameras are everywhere. So if you do something that is not ethical, it's going to catch up to you. I don't think any physician or medical or healthcare professional will intentionally expose you to any disease or sickness. So I think it's a myth, and we should lay away those fears and make sure we go for a proper treatment when the time is due.
Okay.
Well, I think in order to gain respect, gain trust, like if you come and you see me, you're scared. And then I think the way to handle it is everybody in the medical field give their treat your patient as your family. If I see you coming in, I see you're stressed, I can see you're scared, I'll try and put my feelings into it. It'll be okay, put my feelings into it. Everything is going to be okay. But the thing is, we're going to try to do this step, like gain your trust, and that's how you can feel the trust and confidence in me. I think if you were scared, I would try my best to fulfill your needs. That's the main thing, And then that's when you feel like, oh yeah, definitely I need to do this and this. I think that's when you have trust in me. It kind of compels you to be more compliant with your medication and your follow up too as well.
Okay. All right. So this is good to have the health fair. I know a lot of people didn't turn up because of the holiday and all of that, and we're hoping that another one will show up where we all can have the opportunity to come and do that.
Absolutely.
What is one thing I would, both for you guys, what is one thing, I know you just talked about a disease that you talked about, you said it's going to be one, it's going to be number one very soon. Is there any other thing that you guys see often, very frequently, that have to do with both women and men? Any disease that you want to talk about?
It's not in my specialty, but I think cardiovascular.
Okay, what's that?
Right, that's heart attacks, heart disease, which can lead to stroke, and so many other complications. But I'll leave that to Dr. Fan.
I'll follow with Dr. Andrews on the cardiovascular condition too as well. So the main thing is, let's say for example, how to prevent that, how to prevent heart attack and stroke. That's the thing that we all talk, everybody talk. The 3 things we talk that I teach my residents, I teach my even my patient too as well, is diabetes, high blood pressure, and cholesterol. If you control that, you control the heart attack, you control the stroke. That's the main thing. This is something so easy, as in like diabetes. It's too hard. Some of my patients would say, I can't do it. I can't do this and do that. I can't take the medicine. But what about diet? Cut back on the sugar, cut back on the soda. If they were educated about diet-wise, it helps so much. Like Dr. Andrew was saying, that if you get treat the underlying problem, which is the diabetes, high blood pressure, that prevents the main problem, which is stroke and heart attack.
Yeah, this is a very good conversation. One thing I want to ask you about is, you find out that some folks don't have insurance, and they're home, and they feel that I'm not going to go to the hospital because I don't have insurance. If I go, they're going to ask me, they're going to give me all the bills. I won't have the money to pay. So what would you say to them, and is it possible to don't have insurance and just show up to, get surgery then? I'll start with you.
Okay. Thank you for asking, Joseph.
Yeah.
This is a very common question that comes up.
Yeah.
In fact, Dr. Fan, when I was in medical school, we had a group discussion, and this question came up.
Yeah.
They said the patient doesn't have insurance. How will you treat them? Without me thinking, I said I'll see them for free.
Yeah.
I almost got into trouble after class. All my classmates were coming after me. Andrew, you see them for free? I said, of course. Life cannot be bought with money.
Yeah.
So if they don't have insurance, they should not refuse their care. They should still go.
Okay.
Especially in this country, they will be taken care of.
Yeah.
And the bills can be taken care of
Later.
later.
Yeah.
Life is so precious.
Yeah. Yeah.
Absolutely.
Okay.
It's an issue that we face every day. Some people, a lot of people, don't have insurance. They come see me with no insurance. What I do is, they're willing to pay that initial fee to see me. Unfortunately, it's through their network and everything like that. You really can't stop that. But they see me. But if they see me, I will put in 100% of my work. Basically, let's say they don't have insurance to buy the medicine that they need. Very common I see. They lose their insurance. They lost their insurance. They forgot to renew their insurance, so they have no insurance. And what I do is we use coupons. We use different pharmacies to try to connect with them. Because some of the pharmacies have great deals, like $5 for 90 days medications, So like the main thing we were talking about, diabetes, high blood pressure, cholesterol.
Yeah.
There's medicines out there that are very inexpensive. They can apply coupon, maybe even free too as well.
Yeah.
We have so much resources, but they don't know that, and that's my my responsibility.
Yeah.
Hey, I have this resource, this coupon. Here, I'm gonna give you a prescription. You go to this pharmacy and get that medicine for $5. I know it's a little bit expensive, but work with me. Try to get this medicine. That's what I do. I try my best. I put in 100%. I know they don't have insurance, but I'm gonna help them. Try to help them insure, because we have people that reach out to them and try to help apply for insurance.
Yeah.
And I completely understand it's hard. Sometimes they can't get insurance, but I will try my best and get their medicine and get what they need.
Yeah, and we have a lot of folks that came from different countries, and they end up in the States, living in America. And some of the countries, people don't usually go to the doctor to take medication. They just sit home. And my mom used to, when I'm sick, she used to just fix something, some herbs and stuff, and give it to you. And I don't know whether it's the right thing she's doing, but you get better. Okay, so people coming to the States and living here, and when they find out that the kid is sick or something, they usually just go across the street, get something, and give it. What would you say to them, to those who just get something? Is that the right thing to do? From both of you, Dr. Andrews.
So, can you clarify the question one more time?
Yeah, people would give you without contacting the doctor. That have certain sickness, they would just come and just give you medication. And sometimes you try, and the person end up getting sick more because you don't understand what it's doing.
You're trying to do it.
Yeah.
Okay, my advice is that don't do that. That's why doctors are there. Seek the help of the doctor to prevent anything worse from happening.
Yeah.
You are not trained as a medical doctor. Don't act as a medical doctor. Contact us, and we'll always help you. If you don't have money, there's ways we can work around to help you get better.
Okay.
Take care of your life.
I know that a lot of my patients they bring in herbal medicine, they bring in a whole bunch of stuff. I love it because I can actually see it and read it and I go over them. That's why I do with my patients. Hey, can I take this medicine or can I do this? I'll talk to them. Hey, my medicine has this and this. It can cause this. I'll tell them too as well. I know certain things that that's when I don't know. I'll look it up and I'll call them afterward and I say, hey, this medicine has potentially this cause this problem, other problem too as well. So stop taking it. Or if this medicine has no effect, but it has some contributing factor to it too, antioxidants, anti-inflammatory, it might help. Then I'll definitely encourage it. There's always leverage and always different medication out there in the world, but some might help and some might not.
Okay, so those of you that are watching, want to say thank you for watching. Keep watching. I got other guys that are coming up, but unfortunately, I have the two doctors, and guys coming in. I can't keep them for a long time. They have to leave. So thank you for watching. We'll be right back.